My name is Katie Powers, and I am the Southwest organizer for Oklahoma Policy Institute Together Oklahoma. I am 28 years old. I was born and raised in Lawton, Fort Sill, and I come from a military background. So until I was 18 years old, all I knew was Army medicine. And transferring from a military community health-based program to a civilian community-based program is a lot for a young woman, and really any young Oklahoman. When that happened, I was not chronically ill. I was young and vibrant, 18 years old, barely went to the doctor, didn't need to go, didn't even know anything about healthcare initiatives. And then as I proceeded into my 20s, I developed several autoimmune disorders and started that medical journey of getting diagnosed, which takes several years, and really exploring different sides of healthcare. The hard part about chronic illness and disability in Oklahoma is accessibility and also just knowledge and advocacy from the patient in the doctor's office. With me, it's an invisible disability. From the outside, I look perfectly healthy, and you wouldn't know that I have 8 different doctors that I go to and that it's a daily part of my life. My Medicaid journey specifically started last year with the Medicaid expansion. I was out of work. I was looking for jobs, which is really scary to not be insured as a chronically ill, disabled person. And so having that literally saved my life. I was able to go to the doctor, access medication that I take every single day. I was able to access new services that improved my health beyond what I had even been able to access before, such as physical therapy. I was in the gap for just a few months, which is extremely fortunate for myself. Even though it was a short period of time, the effect on my health from just not having that access and not having that medication was profound. It took me twice as long to get back to where I was instead of having that consistent access to those things that I needed for my daily life. Medicaid was the only way forward. And if I didn't have that coverage, if I wasn't qualified for that, when they did the expansion, my health would have been considerably different. Even though it took a while to get back to a point where I could be up and moving around and I could be employed again, without the access, I would be completely disabled. That means that I would be so fatigued, I couldn't make a phone call to my loved ones when I wanted to. I couldn't take a shower by myself. I couldn't do things daily that you do as a 28-year-old, doing dishes, driving your car. All of these things operate off of energy levels, which I depend on in my body through medication, daily thyroid medications, daily pain medications. And without those things, I wouldn't be able to live my life the way I do now. And so I'm very grateful for Medicaid for the time that I had it. I will say that I am a cis white woman living in Oklahoma. And so all of my story is amplified tenfold if I was a person of color, if I was in a marginalized group of any kind. That is why I think we should definitely step up, be involved, be advocates for yourself, but for others, and be as informed as possible. And that's something that myself as an outreach person for our organization, but also our resource site will help you do for voting, for finding your legislator, for finding healthcare information, and for sharing your story with Medicaid. All of those things go into furthering the conversation. And so definitely use those resources.